Kathleen Listen. I am a certified lymphedema therapist and board certified massage therapist and author of the Plastic Surgery Recovery Handbook. And I want to talk to you about how to recover from plastic surgery, liposuction, Brazilian butt lift, facelift, tummy tuck when you cannot get access to a lymphatic massage therapist. So this happens the whole year round for some people that live in areas with less population, lower population, where there physically isn't one practicing. But in this time in 2020 in the spring, almost nobody has access to a lymphatic massage therapist. I practice in California. The entire state is shut down. Massage, we have been told specifically by our certification board that massage is not an essential service. We should not be offering it. So and it's kind of the same reason why I don't have my beautiful fake eyelashes and why my bangs are way too long. Like, we're just not getting anything that's the usual services that would help us be our best. So lymphatic massage is one of those services. I highly recommend it. So what people are asking me is, how can I massage myself? So I can talk to you about how after surgery, if you start at like 4 or 5 days and you're not using like an artificial tool, you're just using your hands, I don't think there's really a time when you can harm yourself. Just doing a little self-massage, keep it to 5 to 10 minutes. I don't think you're really going to hurt yourself. So one of the points where you could start hurting yourself is if you buy like a massage machine, one of the more serious tools that they use for like a sports massage. That's a tool that requires training and a therapist who has training to use it properly. So what I'm scared of is, while it might be completely wonderful to use it, just for everyday aches and pains, if you've just been through surgery, it scares me, and I draw my clients away from it pretty quickly if they're going to use any kind of blasting tool, deep tissue massage tool on themselves, because there's certain types of lumps, bumps, scar tissue that it takes a specific technique to get to, even it out, improve the skin, and getting in too deep too soon after surgery is going to have a negative effect, and it's going to happen. And if like you don't have a massage therapist like 2 days later that you're going to, that can kind of warn you off from it, I'm just scared that too much too soon is going to be too much for a lot of people. So I would definitely be more conservative in how you're massaging yourself. So I have the book. I give a copy of this book to each and every one of my clients, because recovery is not just seeing me for a massage once a week, twice a week. Recovery has a lot to do with the techniques I talk about that you can use in between every massage, how to reduce swelling, and it doesn't have anything to do with massage, how to reduce fibrosis, and it doesn't have anything to do with the lymphatic massage. So the book and the massage go hand in hand. So if you're able to massage yourself, I would also jumpstart your treatment, get a better result by using the techniques I talk about in the book. They're all research-based. I give the research in the back. There's about 5-10 pages. I'm trying to see if I can find it. There's like all these pages of resources that you can look at the study, and you and your surgeon can have an email conversation about the study and whether you should do it. So I talk about the correct way to dry brush. And if you're going to do a self-lymphatic massage, it's a gentle skin stretching stroke. So I'll do it on my face. It's really gentle. You see how I'm just pulling the edge of the lip. I'm not really going deep. I'm not in a muscle, but I am stretching, and you have to feel that stretch till the end. I'm not sliding my skin. I'm just stretching it until it's done and then letting it go. Stretching till it's done and letting it go. And that goes towards the lymph nodes. So you can find a chart with how your lymph nodes are online. If you can't find that chart, there's a chart, the dry brushing chart. That same chart you can use if you've not had a tummy tuck, to properly go to the correct lymph node from the correct area in the body that you're directing the swelling, the fluid. If you have had a tummy tuck, I would like you to direct everything to the underarm, to the axilla. And that's just because the line was cut. We cut out some of the skin physically. It's missing from your body that would direct the fluid down to the inguinal. So you only have the skin left on your body that goes naturally up to the axilla. So let's do what the skin already wants to do, direct all the fluid up to the axilla. But for me, what is absolutely key to your recovery, to your fast recovery, to your increased comfort is that compression garment. You have to get it right. So a lot of what I do, a lot of my magic is not so much with the massage, but with having another set of eyes on the compression garment. And my clients, sometimes my clients are surprised, but more and more often my clients know. They walk in and they're like, I went to the surgeon, they didn't have the correct size of compression garment, so they got me one size over. You know, they'll say, oh, like when I got into the compression garment, I told them it was too tight. I just kept on feeling like it's really tight, it's really digging in. And it's that and my education in compression that enables me to give you the foams, the different pieces of foam, and I talk about these a lot in my video on YouTube, the different types of foams that we can place inside the garment to make sure that it's not wrinkling, bunching, pulling too tight. Because again, as I mentioned in the Plastic Surgery Recovery Handbook, there's several reasons why there'll be not the best result after plastic surgery, and a lot of them are due to the compression garment and it fitting wrong, it causing waviness, it causing lumps and bumps after the surgery. And we really need to get foam in to the point where everybody, if you come into my office, no matter what surgery you've had, if you don't have a liposuction foam coming into my office, you have one going out. That is how important liposuction foam is. It is an absolute game changer. It's less than $10 a sheet. I don't know if you can get it on Amazon anymore. I usually give it to I usually send people to Amazon if they want more foams. But I would look into if you can get liposuction foam and put it in your garment. Get a correctly fitting garment. Get a garment that if you had liposuction up to right underneath your breast, that garment needs to cover up to right underneath your breast. If you had liposuction under the armpit area, your garment needs to cover where that liposuction is, or you're going to get some chunkier swelling. Can we move it out? Absolutely. If you have access to lymphatic massage therapists, that's not a problem. But if you don't, the garment needs to do 100% of the work, and that's where we need an accurately, wonderfully fitting garment. So right now, because you can't see me, you probably can't get a garment personally fitted to you at a store either. That's why it's so frustrating to see just the posts, the struggles of women who are still going through with their plastic surgery, even though we're under the shelter-in-place order, because there's the resources that I would easily be able to show you are just mostly not there anymore for you. So what you're going to have to do is make sure you have a correctly fitting garment. If that means before the surgery you go in and you either have the garment, you make sure the plastic surgeon has the garment, you put it on, it fits you correctly, it's not too... If it's too much fabric in the torso, if you're short torsoed and you get a garment that's made for a longer torso, fabric's going to bunch, and that's going to cause, it's going to go right on your skin. The solution to that is to put the foam inside the garment. That's why you have to have foam, and just more and more foam. If you are long torsoed and it's for a normal or short torso, you're not going to get the accurate coverage. So I would usually make sure you have a foam that goes right up to underneath your bra line, or get a bra that covers that area too, just to make sure you're covered. So that's really the big thing. The major thing is to show, and this is the one reason, I guess, why I'm happy I have jowls. So you can see that there is a little skin stretch when you move like this. So you're going to do that same gentle skin stretching movement on the abdomen. if you're working over a rib, so the easy thing is if you're working above the navel over a rib, it's going to be stretched. You're stretching the skin towards the axilla, towards your armpit. If you're working on the part of your lower abdomen underneath the belly button, you have not had a tummy tuck, you just have liposuction, go ahead and just move it down, and it's going to go down to the inguinal lymph nodes. So you can definitely Google that. You can see a picture of where the inguinal lymph nodes are. If you need more of a chart, if you have arm liposuction, leg liposuction, definitely the chart is here in the book. A lot of my solutions that I talk about and I share the research about for fibrosis, if you are over a month, over 6 weeks out for your operation and you feel hardness, lumps, bumps, you're really scared, that's where we get into using more of these foams. It's just really hard. I don't know where you can get them. I don't know if the companies are shipping anymore. You really need the guidance of a lymphedema therapist to use these more targeted interventions for fibrosis. Hopefully we will get out of this shelter in place within the month, and then definitely if you feel like you have fibrosis, you need to go to a lymphedema therapist. You need to go to your lymphatic massage therapist that experience. Right now, what I'm going to say is I have not seen people who have had a really, really good result that they really enjoy just from getting in those massage machines, just ones that bang at you, or like a tool that just, and then you just rub it up and down. There's a skill set to using those tools. I have a bachelor's degree in massage therapy. It was a 135-hour program to learn just lymphatic massage itself. So it's nothing that I can show you in a video that you can replicate the results from a lymphatic massage therapist. But the good thing is that I have seen results in successfully reducing people's fibrosis and making them happier with their results if they come to me at the 3-month mark, 4-month mark, 6-month mark. So if you could sit tight, you could just use some foams and keep in that garment and keep with a healthy diet, and exercise is a huge thing. So if you can do the exercise that targets over where the fibrosis is. So if you have fibrosis in the abdomen, your doctor has cleared you for exercise first, definitely get onto some abdomen, some core work exercises. Keep the muscle layer moving against the skin layer and the fascia layer. That may really help the fibrosis there. So I talk more about my different tips for reducing fibrosis in the book. I just highly recommend, if Amazon is still shipping out the books, to get a book into your hot little hands. And if they're not, it's definitely also on the Kindle. It is also in Spanish, both in paperback and Kindle. So that is my advice. And geez, what else would I say? There's lots of videos online that talk about lymphatic massage. If it's not really a skin stretching stroke like you see on my face, it's not proper Vater style manual lymphatic drainage massage. And I just would not recommend going to see just any lymphatic massage video on the internet. So there's a really good video. I went to one of the top 4 lymphatic massage schools in the US, Close Training. Close Training has a video of where they will show you the lymphatic massage on the arm and on the leg at compressionguru.com. So that's also a really good website to get some of these foams products. Compressionguru.com. And then if you look on their homepage, if you scroll down a little, they'll say, see this video series. And then I think you just have to give them your email. You don't have to pay for it. If you want to get the DVD, you can get the DVD, but the videos are free online to look and see more of a specific procedure for doing the self-manual lymphatic drainage, and they teach it to you as your client that has a swelling problem. And so it's great. So it's not like therapist to therapist where they use any inside words. It's really easy to understand. So I would definitely recommend, if you wanted more specific protocol for the lymphatic massage, definitely go to the Compression Guru videos, the Close Training videos. Actually, one of my teachers is the person that shows you, so it's great. And then if you want more advice on how to reduce swelling, how to reduce fibrosis, get the copy of the Plastic Surgery Recovery Handbook. It's available on Amazon in Kindle and paperback. All right, thanks.